the most important point that I took from the presentations was the value of biomarkers, particularly those that didn't require CSF estimation, in characterizing either risk for dementia or discrimination between subtypes of dementia. There's been a lot of work ongoing about trying to understand the value of the data, both in differentiating people in earlier phases of particularly Alzheimer's disease, so people with mild cognitive impairment, subjective cognitive impairment, and differentiation of these populations from frank dementia and from cognitively unimpaired. We still have quite a long way to go, but it's good to see that there is progress in identifying which biomarkers will be useful and how to use them. I don't think that for usual clinical practice, the biomarkers are ready for prime time. Hopefully they will be in the future, but we do need to understand the effects of variability and what contributes to that variability. And we saw in some of the presentations the effects of comorbid conditions such as raised BMI, chronic kidney disease, how they can affect some of the biomarkers. That was data I hadn't heard before. None of the other presenters referred to it. But obviously, those sorts of conditions under the circumstances that were presented could give rise to respectively a false negative or a false positive. I think my key takeaway is that we still have a lot to understand, and particularly about the interaction of aging with aspects of neurodegeneration and the particular individual risk for once the body starts to decline in its function, i.e. aging, then how other factors determine expression of disease. And then I think the other key takeaway was about the development of algorithms, but we may be wanting to target initially looking at algorithms for development of aging, more rapid senescence, or dementia in general, and then focus down on a different algorithm to look at risks within subtypes of dementia.